Thank you, Dominique. So we'll go ahead and get started with our opening here. And for that, I'd like to introduce Ethylene Ironcloud Two Dogs. And to introduce this webinar, we will be describing the rationale for developing a tribal suicide surveillance project. We'll also talk about the methods that we used for this study, and we'll be able to share some preliminary findings from our key informant interviews that we've been collecting. And finally, Ethylene will speak with us again at the end, and she'll be talking about cultural considerations of tribal suicide surveillance. So why do a tribal surveillance project? And it's pretty obvious that suicide surveillance is a hot topic out in our society today. There's a lot of funding going out requiring data collection. And so a tribal suicide surveillance project was really timely. I felt blessed that my supervisor at SPRC asked me to take the lead on this project because of different tribal customs and values and taboos in tribal communities. Collecting data on suicide is a really sensitive topic. So we definitely want to have a discussion around this and see what kind of tips and tools we can share with each other. In speaking with the tribal or the Garrett Lee Smith funding, which SPRC is tasked to provide technical assistance to grantees for that, we realized that some of the priorities and the funders are to collect data to show the impact of the project. So they want to see that suicide numbers are going down. They want to see the completion rates reduced based on the funding that's going out to a lot of tribes, states, and campuses. So this is very relevant to our work. We want to be able to be cognizant of the requirements and also cognizant of the tribal values and customs that are out there among Indian country. So this is what we're trying to address in this webinar. As I said earlier, many of us Native people, we do not separate our customs and our values from our daily lives and activities. So sometimes when we're tasked with a non-traditional method of collecting information, we really have to be considerate on, what are the customs in the community. And so this picture I have in the middle, it's because it reminds me, in my community, my elders have told me it's not appropriate to collect how many people that have died in a year. But yet, looking at that photo, epidemiology is all about data collection. And so I just wanted to highlight the cultural differences, but also that we can integrate some of those values into having suicide prevention projects in communities that work for the community and done in a respectful way. So this is what we're trying to really have a discussion about. So this tribal surveillance project will explore and identify resources, strategies, and success stories that tribal communities can use to develop and monitor suicide in their communities and to demonstrate the impact of their projects. So we really want to see what is positive, what are communities doing out there that they can share with others, given this, this hard task that we all have. Some of the methods that we've been using in this study is initially there was a literature review conducted, and Melissa will be talking a little bit of some of the data and the findings, but she had an instrumental part in the literature review, looking what is out there, and she looked at research articles and studies in Canada, Australia, New Zealand, and our own United States. And another method we use are key informant interviews. And that's the subject of this webinar today, is what we found out from the key informants. So it was really neat. Some of the data we'll be sharing comes from 21 total interviews that we've conducted in the month of July and August. And some of those interviews had more than one person. For example, epicenters, they might have had 4 people in on the interview. So we had like about 30 individuals by the end of our data collection. And there will be a quantitative survey forthcoming to tribal GLS grantees. So hopefully, to augment the study, we'll have the qualitative interviews and some data, quantitative data, to be collected. So we wanted to share one of our first questions that we asked interviewees. We asked them, have you seen any examples of or been involved in developing or maintaining successful tribal surveillance systems? That was our first question, and if they said yes, we asked them to describe the elements that made it successful. We really want to capture what worked, because we all have come up against so many barriers. We know a lot of the barriers, but we wanted to find out what works in tribal communities. And so that's our question. And we'll be sharing some preliminary findings. So I'll be turning it over to Melissa Adelson, who will be going over the next few slides in this presentation. Thank you.
All right, thanks so much, Doreen, and thank you everyone for joining us today. As Doreen mentioned, today we're going to be providing a very brief snapshot, primarily of findings from the key informant interviews we conducted. We're thinking of this webinar more as a teaser. And we do plan to provide much more detailed findings from not only the key informant interviews, but also the literature review and the forthcoming survey that we plan to roll out over time. Thanks to numerous wonderful and very wise key informants, we've gathered lots of rich information on data collection, data sharing, and data dissemination that we hope to roll out over the course of time, using not only calls and webinars, but also developing some tools and resources based on the information. So in today's presentation, all of the key informant input is going to be de-identified, but in the future, we do hope to invite some of our key informants to present directly on their own successes. So we'd first like to start by just acknowledging a few challenges that we heard, and then switching our focus over to strategies. Numerous key informants did mention some challenges that they face. One big one is that what works in one community might not necessarily work in another. There's a very broad array of grantee settings, a single tribe versus multiple tribes working together, urban versus rural versus frontier settings. And so one of the big goals of the key informant interviews was to learn about a variety of approaches that work that could be considered and tailored for each type of setting. Also, for organizations that are serving multiple sovereign nations, efforts can be complicated by the fact that each nation owns their own data, has their own decision-making groups, and their own decision-making processes. So again, even within one single grantee setting, there's no one-size-fits-all approach. We also heard from a number of key informants that it's challenging to show significant change from year to year in suicide deaths, because they are fortunately infrequent in many communities. And a number of key informants also noted that sometimes in reducing suicide deaths through increased screening and intervention, they often then saw an initial uptick in reported suicidal ideations and attempts. We also heard from communities who struggled with collecting sensitive data. Data privacy issues made data sharing a challenge in a number of communities, and suicide surveillance systems that multiple partners can populate require layers of security. And lastly, we heard from a number of people about the challenges related to infrastructure that is required for a complex surveillance system that can be populated and accessed by multiple partners, especially as it relates to lack of connectivity in different communities. We also heard lots of wonderful general wisdom, and one of the key themes that we heard over and over was to keep it simple. Several of the key informants spoke about pilot testing a survey tool or a process in 1 or 2 communities first, and then refining and sharing with additional communities over time as resources permitted. We also heard that from several informants that if the capacity, resources, and readiness aren't in place yet for a comprehensive online surveillance system shared by multiple partners, to just start where you can. We heard a lot of stories about people planning to develop a really complex integrated electronic health system and finding that they just weren't there in terms of readiness and resources, but had great success with just using simple forms and tools. We also heard from a number of informants the wisdom to only take the time to collect the information that you really need and that you'll actually use. A lot of respondents spoke to the burden that too much data collection can place on communities, families, and individuals. So next, we'd like to share just a couple of case studies. These are going to be very brief, and the hope is to share more information in the future and work with the key informants who we spoke with to gather more information about tools and resources that they would be willing to share. So one of the case studies is from a tribal nation that adapted the Centers for Disease Control's self-directed violence surveillance tool by adding and revising indicators as was appropriate for their communities. So a crisis response team was initially trained in one of the communities, and then after that initial pilot, a second crisis team was trained in another community. And those teams would go out and collect just a minimal amount of information from families and survivors when responding to a call, taking only a few notes and then making observations. Then after responding to the initial call, the crisis teams would work very closely with law enforcement, behavioral health, and other partners to debrief and complete that suicide surveillance form that was based on the CDC tool. So they took a look at what information was collected on the initial call for help, what observations were made by the crisis team at the home or setting, and then what additional information might be available through behavioral health that's on file about that particular youth or young adult. The form was then also used to track follow-up care, and information was added at a later date about care that was received and improvements that were made. It was also noted that the team currently uses the Centers for Disease Control EpiInfo software to manage their data. So the communities are able to enter their data into EpiInfo, which will eventually be shared with the tribal prevention specialists serving the whole nation. A second key informant that we talked to described a different surveillance approach. So they have a tribal consortium that generates suicide risk reports using their own electronic health records. And a community alert is triggered for anyone presenting with suicidal ideation or behaviors, anyone needing psychological emergency services or crisis interventions, or anyone screening positive for depression, anxiety, or trauma. In their system, they also flag anyone who's seen for a traumatic event, such as domestic violence or a sexual assault. Then, in addition to their own electronic health records, they have an agreement with an area hospital. So any tribal consortium beneficiary coming into their emergency room is flagged, and the consortium staff receive a daily report on those who are admitted to either the mental health floor or persons who are directly listed with a diagnosis of suicidal ideation or attempt. The team then, on a weekly basis, reviews the data from both their own electronic health records and the area hospital, and asks for any verbal information that the team might have about other potential suicide risks in the community. So then weekly they compile and cross-reference all of the data from each of those sources, reconciling any duplications that they might be seeing. And in addition to monitoring risk over time, they also use the reports to create a flag if there hasn't been any follow-up care. And they're currently using Access to manage their data. So again, moving forward as we roll out information, we're hoping to provide a little bit more detail on some successful suicide surveillance systems and the tools and software that are used to manage them. We also asked key informants about other important factors to monitor in their surveillance systems in addition to suicidal ideation, attempts, and behaviors. And key informants were more likely to report tracking risk factors as part of their surveillance efforts as opposed to protective factors. Documenting history of suicide deaths and attempts among family and friends was noted as very important. And a number of key informant interviews also spoke about the trauma experienced by suicide prevention specialists and emergency responders in their communities. Key informants often mentioned mental illness and substance use as key risk factors to monitor over time. And a lot of people talked about adverse childhood experiences, such as physical abuse, sexual abuse, exposure to violence in the home, and family conflict and disruption. Some are actually using an ACE survey instrument as part of their surveillance efforts. But we also heard from a few informants that acknowledged that readiness within the community to address some of those root causes, like child sexual abuse, may not always be high in a community. So again, starting where they're able to and where the readiness is at, but monitoring some of those upstream risk factors to address when the readiness is there. While key informants readily listed protective factors that they thought were important, a number acknowledged that the communities they work with could do a better job of actually collecting data on measures like family and community support, cultural identity, coping skills, and connectedness within their surveillance systems. Many spoke to capturing protective factors as part of evaluation of specific programs, but several said that they were still working to incorporate collection of protective factors within a broader surveillance system. A couple of key informants suggested important evaluation measures related to protective factors. One noted measuring an increase in the number of people who know where and how to access support and services. So the example was provided of a mom who knows what number to call if her son is experiencing problems. Another factor noted was behavior change that results from a suicide prevention training. So then, rather than simply tracking the number of people who attended a training or increase in knowledge after the training, finding a way to measure the changes that result in behaviors due to that training in the community. So Doreen mentioned a literature review that we conducted where we identified a number of different articles on risk and protective factors that are associated with suicidal behaviors among American Indian youth and young adults. So as we move forward, we'll be using a combination of key informant interview findings and the literature review to dive deeper into factors that can be addressed at the individual, relationship, and community levels. And then also taking a look at research that explores the cumulative impact of multiple protective factors. In addition to diving into protective factors like cultural continuity, school connectedness, and peer social support, we'll also be taking a similar look at a number of risk factors identified in the literature and from the key informants, and taking a look at the cumulative impact of those risk factors as well. So we'd like to take just a quick poll to see from those of you who are participating on the webinar today, which protective factors do you track as part of your surveillance efforts? If you could just enter into the chat any protective factors that you track, or if you work with communities or community partners, maybe note any protective factors that you know they track. Overall health and life circumstances, cultural connectedness and hope. We often heard from key informants that they had either found or created tools to collect information on cultural connectedness. The family circumstances, and we often heard key informants talk about family circumstances both related to risk, such as those adverse childhood experiences and family conflict, but also protection. So family support, family bonding, being able to communicate with your parents and grandparents and aunties and uncles about problems you're having. We heard often from key informants about participation in positive and pro-social cultural activities in the community. Great, wonderful. And what we're hoping to do too as we move forward is not only identify protective factors that are being monitored, but also identify and share tools that communities are using to measure and track these items, such as cultural knowledge and practice and cultural identities. Wonderful, thank you. We've got a few more coming through here. So having utilized referrals, medications that people have been prescribed. So in addition to more upstream protective factors that can prevent suicidal ideation, we also did hear about a number of protective factors for those who have already reported ideation and attempts, and how tracking of resources and supports in the communities have been infused into surveillance systems. Positive and trusted adult relationships is definitely something that we've heard from not only families, but other adult relatives, teachers, members of the community. These are all wonderful. Doreen, did you want to chime in?
Yeah, sure. Thanks, Melissa. I just wanted to say thank you so much for people typing into the chat, because this is really what we want to have, is like a discussion and sharing with each other, so that we can have these ideas out there and people can take them and use them as they, come across something neat. So I'm really just glad and wanting to thank everybody for engaging with us in this poll question.
Thanks, Doreen. All right, Dominique, if we could take it back to the webinar. I just wanted to follow up a bit briefly. I know Doreen mentioned that we did talk to a number of staff from tribal epidemiology centers across the country, and we got a lot of great, rich information. Again, not to dwell on challenges, but just to acknowledge them. We did hear key themes from a number of tribal epicenters on challenges that they face, including limited staffing and resources, limited access to IHS data, and then sometimes only in aggregate. A number of key informants said that the communities they serve can often better access some of the data than they're able to. Some of the tribal epicenters serve a large number of states, which makes it difficult to support all of them. And then it's also necessary to have agreements in place with all of the tribes that are served. So that can make it challenging if there aren't those agreements in place already. But we did hear about a lot of ways that tribal epicenters are able to support communities. And some of the examples that were shared were that techs can house and analyze data on behalf of the tribes. So the tribes maintain ownership over the data, but the tribal epicenters described processes that they use to report aggregate findings that they share then only with permission from all the participating tribes, and then being able to do more detailed analysis at the tribal level and shared only with those tribes. They also reported helping to access data from state-level databases and registries in cases where the tribal epi staff might have better relationships in place with those who oversee the state-level databases. In some cases, they've also been able to help improve statewide data collection efforts to increase sample sizes for tribal communities from surveys like the Behavioral Risk Factor Surveillance System or the Youth Risk Behavior Survey. And in addition to helping to increase sample sizes, some of them have also been able to help improve statewide surveillance systems to make sure that information on race and ethnicity is captured and collected in a valid way. And then lastly, we heard from a number of tribal epicenters about successes that they've had in helping to develop reports, presentations, profiles, and infographics with input from the tribes. And moving forward, as we roll out the findings from the key informant interviews, we're hoping to provide some examples of ways in which the data has been successfully disseminated. Now I'm going to turn it back over to Doreen.
Okay, thank you, Melissa. Thank you so much for sharing some of those preliminary findings with us, and there will be more to come. So a couple of the surveillance success stories that SPRC has been highlighting are on our website, SPRC.org. There's a White Mountain Apache who has developed a successful tribal surveillance system with support from their tribal leadership. And then Fort Peck Indian Reservation, they're one of our highlighted success stories in SPRC's website this month. So if you get a chance, check those out. They have a lot of great information. And I remember the Fort Peck, one of the takeaways from that was that it was really important to develop the relationship between the researchers, the tribal leaders, and the healthcare providers in that community. That was the key to building the successful surveillance project. And that's what I heard over and over again in conducting the interviews, that building the relationships in the forefront is key. So I just wanted to highlight those two as some of our surveillance success stories. Next, I'd like to hand it over to Etheline, Ironclad 2 Dogs, who will talk about cultural considerations in tribal suicide surveillance. And Etheline, it's all yours.
Thank you, Doreen. Hello again, everybody. Hope you're having a good time on our webinar. Hope you're gathering some very useful information. I am. Thank you so much, Doreen and Melissa. It's been very helpful and informative so far. So what are the cultural considerations of doing a tribal suicide surveillance project? There are definitely some very distinct ones, and I know that in your own respective communities that you have cultural considerations that may not be mentioned here. So and anything that I say is basically from my perspective as a Lakota person. And so I try to be as sensitive as possible to other cultures, but sometimes boundaries are crossed, right? So if I say anything or show anything here that's offensive to you culturally or your community, then I apologize. It was not intended. So we're going to be talking about, for example, the relationship focus. Acculturation, say we're acculturated into another culture. We ask questions first, and I'm thinking about like the Western mainstream culture of service delivery, of helping. We ask questions first. What is wrong? What is what do we need to address here? Instead of asking what happened, So and then we fill out forms, right? We want to get this information down. It's very individually focused, very impersonal, and our training in Western institutions tell us that we need to be impersonal. We need to get the information. Contrast that with enculturation, somebody that is very steeped or immersed in their own respective ethnic, racial culture. For example, in this example, I use relationship building. So if we were to do a tribal suicide surveillance project and we use this model of enculturation, then we would build relationships first. We would focus on establishing a respectful relationship. We would try to maintain that and nurture it. We would focus on reciprocity. I'm asking you for something. What am I giving back? For example, to a community. We would focus on comfort and care. We know when we're asking people about suicide, then it triggers some very, very sensitive and painful feelings. So we need to have the comfort and care in this approach. The focus is on family, not just the individual. When a suicide happens, we know that it impacts the entire family, the extended family, the community. So those are cultural considerations in the area of relationships. What about time and space? If we want to gather information, we want to do a surveillance project, then we really need to be deliberate and sensitive. So, for example, if a community has experienced a great, has a high rate of suicides in their community, then it would be very difficult to go in and ask questions at that time. The time needs to be used for comfort and care, and what can we do to help? So the sensitivity needs to be there also. What about the setting for the surveillance information to be collected? Are we asking people to come into a place? Are we going to their office, their community? You know, we need to really be deliberate about that. If you have any questions, then don't hesitate to type them into the chat. I know that Doreen and Melissa and myself will be open to responding to questions regarding this webinar. The power of words are definitely an important cultural consideration. For example, acknowledging the dark spirit, which exists in many indigenous communities where there is a high rate of suicide. This can be considered an invitation for it to return. So if we talk about the dark spirit in some indigenous communities, that would be frowned upon by some of the more traditional people, elders, that would consider that an invitation for it to return, or as opening a door for it to return. Speaking the name of someone who has passed may be taboo among some tribes. So we need to consider that too. What community are we going into? What culture, what tribe, what nation, and what are some of the taboos that they have about suicide? So we really need to find that out before we embark on a tribal suicide surveillance project. Talking about a person who has passed may be considered disrespectful. So there's these concepts and these beliefs in indigenous communities that are very powerful, and that can make or break a project. I hate to use those terms, but we really have to be respectful of the community. Again, if you have questions, ask. Go ahead.
Can I chime in on that? The previous slide, when you talked about that it's taboo to talk about death or suicide in some communities, at SPRC, we're trying to figure out, so how do we address that? And one way was by talking about life, about talking about wellness. And so one of the tribal communities I'm familiar with really doesn't use the word suicide in their programming, but it's all about wellness. And so that was one way of going around not having to talk about death or suicide. So I just wanted to mention that. Thank you.
Yes, that is a very important consideration, and it's important to reframe, I guess, the statements, the concepts, so that it does become about life rather than about death. Thank you, Doreen.
Sure.
Information sharing as part of the cultural consideration is not just cultural, it's also about sovereignty. The ownership of the information is definitely a tribal sovereignty issue, and that needs to be addressed in terms of the project itself, in the protocols, policies, and procedures. Who will see the information? The concern might be identifiable information. So if somebody said, well, there's a very high rate of suicide among, a reservation, on a reservation in the Great Plains community, then, that can easily be identified as one of the reservations in the Great Plains because there's very few. So we need to think about that also. How is this information going to be presented? What will be done with the surveillance information? If there's any questions about any of this, then don't hesitate to ask, and we will respond to them. So far, we've talked about cultural considerations and described the project, so I'll turn it back over to Doreen now to talk about funding.
Okay, thank you so much, Ethelene. And, you know, based on our time frame, we could go hours talking about cultural considerations, but I appreciate her going over some of the main things that people should be aware of as they go about and collecting suicide-related data. So this is who funded our project. We also have contact information. SPRC.org has a lot of great resources, and you can find these and others there. We have archived webinar videos there, and we also wanted to share this. There's some free software that people out there are using in collecting their data and maintaining databases. So there's some CDC uses the EpiInfo, Vanderbilt University's REDCap, and REDCap seems to be something that's really user-friendly, and some of the projects are using REDCap because they're using like maybe tablets to collect data, and they're able to do real-time data entry into their software there. So those are just a couple of examples that some of the grantees are using. Here's a screenshot of EpiInfo. Melissa, do you want to talk about this?
Sure. This is just one more example that we heard a few different key informants mention that they use as part of their tribal surveillance efforts. And like REDCap, is very user-friendly and allows you to not only enter data, but analyze it, create dashboards that can then be used to share information back with communities. And as we move forward, rolling out findings, we hope to dive a bit more into detail on a topic-by-topic basis and put together either a call or a tool that just talks about various software that could be used and provides more detail on how to access it and how to use it.